Hello. Good evening. It's another Thursday night Chicks with MD's post. I'm just going to rattle along a little bit until we get some viewers. I'm Lisa Whitty Bradley. I'm a plastic and reconstructive surgeon in the Chicagoland area. And over the last 3 years or so, I've spent an extensive amount of time studying the finance and business and legalities of medicine. And the reason why is because in May of 2013, I was diagnosed with multiple sclerosis. So I had to scale back my clinical practice in order to take care of myself and my family. And that led to me exploring and analyzing multiple contracts that I was under, including my malpractice contract and disability and my health insurance contracts. And also, simultaneously, I was negotiating new contracts so that I could modify my work hours. And in the meanwhile, I also had to navigate through my health insurance policy. And this resulted in me researching specifically what was covered under the Affordable Care Act and how I was protected as a patient, because I was finding that I was at odds with the insurance company. So that's what led to me investigating and becoming very knowledgeable about the Affordable Care Act. And the reason why I'm having this, discussing this topic tonight, the Affordable Care Act versus Obamacare, is because, unfortunately, even after Obama has left the White House, there's still a lack of global understanding of, number one, the coverage that you have under the Affordable Care Act, which is actually called the Patient Protection and Affordable Care Act, versus Obamacare. And I think a lot of people, number one, don't understand that they are one and the same. The Affordable Care Act is Obamacare. There is no difference. And I think, unfortunately, politicians and the media utilize the term Obamacare to marginalize that whole concept. Hey, Harriet, how are you? I'm just talking about the difference between the Affordable Care Act and Obamacare, which we've discussed at length after school on many occasions, and they are one and the same. So the important thing to know is that the media and politicians utilize the term Obamacare to disenfranchise that whole concept of affordable and health care and also patient protection under the Affordable Care Act. So before I go any further, I have a new sponsor for my web talks, and that's AP Consulting. And that's a physician-created and physician-controlled consulting group. And what they do is they find healthcare industry jobs and consultative work for physicians and healthcare providers. And then also that same physician, Joshua Anthony, creates t-shirts, and I have one today, so I'm going to stand up, and if you can see it, it's a woman with a big head of hair, which I had a couple of days ago, and it says what a doctor looks like. So my hair always looks a little bit different, and sometimes that throws people off, like how could she possibly be? But you know, the hair and all of that, it's the external. You know, we come in different shades and heights and all that type of stuff. So to just go over some of the basic tenets of the Affordable Care Act, and I also will have a newsletter that's going to be posted later on this evening that's going to go through all of these points in detail. So if you don't catch all of the different components of the Affordable Care Act, no worries, because I'm going to release a newsletter this evening that goes through everything in detail, and will also provide you with resources so that you can stay on top of your coverage. So some of the main tenets of the Affordable Care Act is, number one, end to lifetime and yearly limits. Unfortunately, especially if you're in the world of pediatrics and you have a child or a patient who required an extensive amount of treatment even before the first year of life, before they're even discharged from the hospital, prior to the Affordable Care Act, those patients would have reached their lifetime limit for health coverage before they were even discharged from the hospital. So as of March 23rd, 2010, when the Affordable Care Act was enacted, that is no longer. So there's no lifetime or annual limits on your health coverage. You also have, for young adults, are still covered under their parents' insurance up to the age of 26. There is prevention of cancellation of your insurance policy by your insurer if you get sick. Sometimes people would have catastrophic medical issues like I had 3.5 years ago, and the insurer would just say, oh, you're too much of a risk, we're no longer covering you. So that's another great coverage point of the Affordable Care Act. Also, you have patient protection from employer retaliation. So prior, sometimes, especially with the enactment of the Affordable Care Act, if a patient got a tax credit, a significant tax credit, your employer would either retaliate or fire you if it resulted in any type of financial burden for the company or the hospital or whoever. That can no longer happen. Grandfathered plans. So if you had a plan prior to the enactment of the Patient Protection and Affordable Care Act, if you wanted that policy, you could continue to have that policy. However, if you had a grandfathered plan, there's a chance that some of the coverage options that you have under the Affordable Care Act would not be in that policy. Also, if the grandfathered plan is discontinued, then that grandfathered plan has to give you a 90-day window so that you can obtain coverage, or so that you can pick from the choices that they now provide. Rate reviews. So your plans cannot increase your premiums more than 10% without providing you written justification of why your rates are going up. So that's something important to know. The 80-20 rule. The 80-20 rule is that from your premiums that you pay, at least 80% has to go towards direct health costs. And then the remaining 20% can go for their overhead or, administrative costs, whatever. But 80% has to go towards your care. And if they are found to not be compliant with that, then you either get a rebate, a reduction in future premiums, or a refund. And if that money is refunded to your employer rather than you directly, then your employer has to utilize that rebate for direct health benefits, for your direct health benefits, or for the global practice benefits. Other things are, which is major for women and children, are the preventive measures that are covered under the Affordable Care Act, which should have zero copay. And Harriet, I know we talked about this before. There are like things such as mammograms and your annual GYN visits and STD screening and colonoscopies. There are a multitude of different preventative measures that are covered where you should not have to pay an additional cost or co-payment. And the most important thing is to know what's in your specific health plan policy. Person to person, business to business, family to family, the policies are going to be slightly different. So you need to find out specifically what is stated in your coverage, because if you had a grandfathered policy, there's a chance that some things may not be covered because you're still in an old plan. So make sure, and when the newsletter comes out, there'll be the preventative measures that are covered will be separated into adults, women, pregnant women, and children. So those are things to know, and those things are essential. Now, the other thing that many people ask is, how is the Affordable Care Act funded? So the Affordable Care Act is funded through what everybody knows is the individual mandate. So there were calculations from 2015 that stated that the amount collected from penalties, or that tax, which is about 2.5% of gross combined family income, okay, was $1.5 billion. Okay, now that sounds like a very big number. However, that is not the entire. That's not even 1% of the funding of the Affordable Care Act. So the remainder of funding of the Affordable Care Act, I'm going to read them off because it is a torrential number of things. So number one, there's an increase in the Medicare tax rate that has already occurred. There's a 3.8% new tax on unearned income for high income taxpayers. So if you're single, that's $200,000 or more, and for joint filers, that's $250,000 or more. There's a new annual fee on health insurance providers, which is about $60 billion annually. 40% new tax on health insurance policies, which cost more than $10,000 for an individual or $27,000 for a family per year. There's a new annual fee on manufacturers and importers of branded drugs. That's $27 billion. Another $20 billion for tax on manufacturers and importers of certain medicines and medical devices. And then there's a few others, but as you can see, the amount of money that is contributed from the individual mandate is pretty minimal compared to what industry is covering in terms of coverage, which is how it should be, because industry, the medical industry, private health corporations, these the big pharma and these medical instrument firms and medical device firms, they make a tremendous amount of profit off of our poor health or health maintenance. And so they should bear the brunt of tax burden that covers the Affordable Care Act. Now, where does the money go? The money goes to Medicaid expansion, and if you've probably heard a lot of discussions on this, so Medicaid expansion, this is for individuals who are under the age of 65 who are below 133% of the federal poverty limit. However, and this has been a major crunch for funding to states, is that the state representatives, or the state, the states are sovereign, they can decline this federal funding. Now, why they would decline federal funding, this usually comes down to politics and party lines. So there were Republican states that did decline this federal funding from the Affordable Care Act, which resulted in underfunding of health benefits for their state citizens, which is unfortunate. Also, the funding goes to tax credits, and the tax credits are available for families up to 400% of the federal poverty level, which is $43,000 for an individual or $88,000 for a family of four. Okay, so once, and then there are cost sharing subsidies. So these apply to individuals and families who are enrolled in a qualified health plan in the silver level of coverage in the individual market. So in order to participate in the cost sharing subsidies, you have to be you have to have a plan under the health marketplace. So under healthcare.gov, whatever insurance plans are participating, you have to participate in one of those plans in order to benefit from the cost sharing subsidies. And then also, of course, federal agency administrative costs also siphon off of the funding for the Affordable Care Act. So with the tax credits and the tax penalties, this has required new tax forms for the IRS. So the IRS does get part of the funding from the Affordable Care Act because they are calculating and deciding what these tax credits and tax penalties are per family, per individual. So those are administrative costs. That's an example of the administrative costs that utilize the Obamacare funding. So we talked about quite a few things, and I just want to, before I sign off, I want to talk about the resources or websites that you guys should really utilize for information and staying informed and involved with the changes in the healthcare law. So that would be the Centers for Medicare and Medicaid Services, that's CMS.gov. Also, Health and Human Services, which is HHS.gov. Also, you can subscribe to our website, which is www.chickswithmds.com. And you can subscribe, and then you'll get all of our newsletters and up-to-date bulletins. Also, please follow us here on Facebook so that you can get these notices for our live posts. Also, I really want you guys to take a look at the newsletter, because you will see the extensive list of preventative services that are provided under the Affordable Care Act. And as a provider, my main concern are the patients that may lose coverage and that also will stop seeking medical attention, either for preventative care or for acute issues, because they just can't afford it. Also, something else that's broadened coverage under the Affordable Care Act is access to emergency medical services that are out of network. Prior to that, if you were like out of town or in another part of the city and you had to go somewhere else that wasn't, you had an emergency, you had a, acute issue, and you went to an emergency room outside of your care network, then you would have to pay out of network costs. And the Affordable Care Act has coverage for that, so that you are not basically financially penalized for going to an emergency room outside of your health network. So, and Harriet, I know we talked about that. Unfortunately, I don't know what the coverage issues are if you go out of a state. I think things start to get a little hazy. But if you are within your state and you're within your city limits, you should have some coverage protection. And if you have any question, I would definitely talk to your health insurance representative. You should be able to find either the representative that covers your policy directly or your regional representative. And you should be able to find that by calling the phone number that's on your insurance card. And the representative should be able to give you information as to who has direct information about what is covered under your policy. Now, you also may want to know what the exemptions are to the Affordable Care Act. So you can be exempt, and I'm going to give you these. I'm going to read them directly off of the source. Your lack of insurance coverage was for 3 months or less. This is an exemption. You aren't required to file a tax return because your income is too low. That's another exemption. You are incarcerated, which means you're going to have federal medical care anyway, or state Medicare, or state regulated and controlled and financed medical care. You are in the U.S. illegally. You would think that that would be, a no-brainer. You are part of a Native American tribe where you should have access to local resources. The least expensive health insurance available to you costs more than 8.13% of your 2016 income and premiums, which once again goes back to your gross income. You are a member of a healthcare sharing ministry. Your religion objects to insurance, or your quality for hardship exemption, which once again goes back to finance. So those are just some things to know, that there are some exemptions. The last thing I wanted to talk about was what has happened since the inauguration in terms of executive orders, and also in terms of the Senate votes to change the coverage for the Affordable Care Act. So number one, the Trump executive orders were extremely vague in terms of action to repeal the Affordable Care Act. And I'm going to read you just a few points that basically globally say he wants to repeal it, and they are working on that process. So the first statement is that they will take all actions consistent with law to minimize the unwarranted economic and regulatory burdens of the act and prepare to afford the states more flexible and control to create a more free and open healthcare market. So basically what they're saying is they want to create a system that's not going to disrupt the financial or health stability of the current system, however, provide a new an alternative to the Affordable Care Act, because they don't have one. The next is work to create a system that allows the sale of health insurance across state lines. So basically what this means is interstate commerce to purchase insurance policies to hopefully drive premiums down, because you'd have a more competitive market. This is actually something in theory that is a good thing. However, I think you're going to have opposition from the private insurers, because it's not good for them. They can't maintain control. You're going to have all these small insurance companies popping up, and they're not going to be able to control the marketplace. So I think you're going to see a lot of pushback from private insurers when they try to introduce interstate commerce or interstate competition between insurance companies. But I think it'd be great for from a patient standpoint. I think it'd be great. The next would be officials should try to reduce costs and burdens on consumers. Well, yeah, I mean, we'd all love that. But they don't have any viable options as to how they would create this environment that we would maintain low costs for consumers and patients. And then the last thing he did was gave federal agencies wide latitude to change, delay, or waive provisions of the law that they deemed overly costly for insurers, drug makers, doctors, patients, or states, suggesting that it could have wide-ranging impact and essentially allowing the dismantling of the law to begin even before Congress moves to repeal it. So basically, he's given a wide range of nondescript options for providers and healthcare corps to try and manipulate the laws that the portions of the law that they feel are oppressive in any regard. So there's not a lot of direction, and there could be a lot of exploitation and misinterpretation of that statement. So we'll see what happens in the weeks to come. And the last thing, this 51-48 Senate vote that they utilized to start the process to repeal the Affordable Care Act, basically this addressed the budget. So as you know, if there's no money, there's no flow, okay? So what they started the ball rolling on was slashing the budget or the funding for the Affordable Care Act. Correct, Dr. Anthony. Aetna. Oh, we'll talk about Aetna right now. So basically this vote was to control the budget or the money flow. So if there's no money flowing to the states, they cannot provide these preventative measures. If there's no money flowing to the states, then you can't control the cost and the coverage for Medicaid, okay, which is a large base of patients that is now covered under the expansion of the insured under the Affordable Care Act. So now what happened with Aetna? Okay, so in the fall, there was a big brouhaha because Aetna and other insurers came out and said, well, we have to pull out of the healthcare exchanges because the cost is just unbearable. It's too high. We can't even cover our administrative costs. And this last week, the court papers revealed that it wasn't a matter of healthcare administrative costs or patient costs. It was the fact that Aetna wanted to pull out of the healthcare exchanges because it's about to, or maybe it has merged now with Humana, And if they had these two big conglomerates coming in and controlling the healthcare marketplace, then it's a monopoly, and then they're gonna be liable. So you really have to follow, which is also why I want folks to watch the business channels after the election. And I fell victim to this too, of getting caught up in these emotional newscasts of MSNBC and Fox and CNN. The discussions are happening on Bloomberg, C-SPAN, BBC, and 1010 Wins in New York. And I'm forgetting one right now, but those are the major, and CNBC. Okay. So what you want to, hey, Dr. Connor Garcia, thanks for joining us. So what you want to do is utilize the resources that are giving you facts and not opinion. Okay. MSNBC and Fox, they're so caught up in their own drama that they are not relaying news. They are just relaying their opinion, which is irrelevant. So I'm going to go through one more time the critical websites that you guys need to have. And I'm also, just for you guys that tuned in late, I'm going to have a newsletter that, will go out from the website later on today. I've been having some technical difficulties with WordPress, which is becoming a recurrent theme. But once I get that glitch figured out, I'm going to get the newsletter out, which will go over all of the points that we discussed today. Number one, the Affordable Care Act is Obamacare. There's no difference. Number two, the major things that are covered under the act that I think we as providers need to make sure that patients still have access to are the preventative care issues, maintaining coverage for patient children that are 26 years and under, the 80-20 rule to make sure that your premiums, 80% is going to coverage and health issues, and then 20% for administrative costs. Also that, let's see, what else do we want to talk about? I just want to make sure we get all of these. Your grandfathered plans, that there are some plans that were in place prior to March 23rd, 2010, when the Affordable Care Act was enacted, that had great coverage, and some people don't want to give up their policies. They can continue those policies. They just need to know that there may be some coverage options that are not in their policy but are part of the Affordable Care Act. If that grandfathered policy is canceled, then your insurer has to give you a 90-day window so that you can either take another policy that they offer or so that you can find a new policy. Also, they have to give you a rate review. So if your rate goes up more than 10%, they have to provide you with a review of why that is. Also, under the 80-20 rule, if they are found to not match that 80%, then they have to either provide a rebate for whatever you paid in excess of what you actually owed. They have to reduce your future premiums, or they have to refund the money either to you or to your employer if you're getting your health insurance from your employer. And if your employer gets the money, then they have to utilize that rebate for health benefits. They can't just kind of, give it as bonuses or whatever. It has to be utilized for health benefits. Also, they guarantee your right to appeal any denied payments or coverage. And then also, you do have the individual mandate. Okay, so the individual mandate is the tax or the penalty that patients or people who opt out of getting coverage under the exchange, they have to pay this penalty. And that's 2.5% of your gross combined family or household income, which usually works out to about $640 for 2016. And that has gone up every year for the last, this is the third year, so it has gone up every year. However, you can avoid the penalty by getting a health policy. So, and the other thing is that individual mandate is not even 1% of the budget for the Affordable Care Act. The rest of it comes from taxes on high income citizens. It comes from taxes on health industry, on medical device firms, on those who import medical devices and drugs. So there's a variety of different things, and that will also be in the newsletter. So, and for anybody checking this on replay, we're also going to have all of this information in the newsletter. Your go-to websites, number one, chickswithmds.com. You'll have newsletters and updates on there. Also check us here on Facebook. We'll post any recent articles, like with the Aetna issue and the antitrust issues that they were trying to avoid by withdrawing from the healthcare exchanges. And then Health and Human Services, which is hhs.gov. Please subscribe to that site because they will keep you up to date on any changes in healthcare reform. Also, Centers for Medicare and Medicaid Services, that's cms.gov. Please subscribe to that site. Those are federal agencies. So anything that the Congress votes on and enacts and becomes active, these are the sites that will give you direct information on what are my rights, what is still covered, what isn't covered, how can I get more information. Also, last but not least, your health insurer's website and your health representative's phone number, name, and also get a copy of your policy so that you know what's on it, you know what your coverage is. Because every policy, every patient, every different household, everybody is going to have a different policy based on what you pay, based on how expansive you want your coverage to be, what you can afford. So those are the main things. If you guys have questions, any questions? No questions out there? So if you have questions and you watch the replay, just put a question up there and I'll make sure I get it answered. I will also put the link for the newsletter on our Facebook page. And you can also subscribe to chickswithmds.com, and then you can get all the newsletters as they come out hot off the press. So thanks for participating. Thanks for being active in your health and in our country's evolving system of healthcare reform. And I'll talk to you guys in 2 weeks. We'll probably go back to reviewing the ebook that was released, The Essentials of Implementing the Next Wave of Healthcare Reform. And once again, Dr. Anthony, I'm going to stand up one more time. This is our sponsor for tonight. That's AP Consulting, LLC. And check out his Instagram and website. And I'll also put that up here once I get finished with the broadcast. But I appreciate our new sponsor. And I will talk to you guys in 2 weeks. Always be well, take care, and be safe. All right. Later.